basically spine is the area where you need to do plenty of ultrasound before you start to use ultrasound for the spine. Okay, because the reason for that is you need to be very good at your needling skills. You need to be very good at finding the levels, counting the levels, and all that. Okay, so we start here, as you already you guys know. So left is proximal, right is distal. So when you see a straight line, that's your sacrum. You all agree with that? Yeah. And then you see the line breaking, L5 S1, L4 L5. It keeps climbing up. So now we're losing the gel. Yep. So sacrum, L5 S1, L4 L5, L3 L4. Okay, that's the way to count the level. All right. Now, once you, whatever the level you want to see, you bring that in the middle of the screen. Okay, so that's the L5 S1 level, right? Bring that in the middle of the screen, and what you do, you just turn the probe that way. That is still the level you're looking at. Okay, so that's the L5 S1 level. All right. The reason I know that's L5 S1 level, because you have your sort of, dorsal sacroiliac ligament, okay, medial sacral crest, and you've got your dural complex. Okay, it's a posterior dural complex. All right, so that's something that I would look for. All right, so that's the L5 level. Now, when you want to do the L5 dorsal ramus block, this is the target for your dorsal ramus block. Okay, here, this is your sacral ala. All right, so you need to bring that in the middle of the screen. That's your spinous process. Yeah, spinous process. But this is the interspinous ligament, because you can see, you don't want to see that when you want to do the L5 dorsal ramus. So you'll bring the needle in that way, put it there, inject the dye, and do the sort of X-ray, and then inject the local.
So this is lamina.
Yeah, that's your lamina. Yeah, that's the lamina.
Facet must be some.
There won't be a facet, right? There will be your sacral ala.
Yeah.
So that's for the medial branch. Okay. If I keep going up. Now this is I describe what I call it as a two-step sign. Okay, step one, step two. Step one is the facet. Okay, so you've got your superior articular process here, inferior articular process, and that's your facet joint capsule. Okay, and that's where you would do. So if you want to do the facet joint injection, what I do, I bring that more clear into this image. I turn the probe that way. Okay, and bring the needle in plane like that, to do the facet joint injection. If I want to do medial branch block, then that will be my target. That's a step 2. Okay, so that's where I would go. That's the transverse process, superior articular process, and that's where I would go. Now it's very important to keep in mind that if I move off the target, the next structure I see is a nerve root. Basically, that's nerve root. Okay, so it's very important that you have a really clear bright line between your superior articular process and the transverse process. Okay. Otherwise, if you don't have that bright line, you'll end up going into the nerve root. Okay, so that's basically the lumbar spine. So how to calculate the level? You just look for the sacrum. Various views, they talk about various views. So if you're talking about the longitudinal sort of, views, there are 3 views. This is the articular pillar view. It's also called as horse head appearance. Okay, if I keep moving laterally,
transverse process.
This is the trident view, yeah, the transverse process. Trident, yeah. So in this case, I can tell you the distance between the articular process and the transverse process is not that long, and its transverse processes are very short. Okay, so trident view, keep going medially, articular view, and keep going more medially. Then you should start to see the intrathecal space at some point. Get more gel, and that's basically that. You can see the dura, yeah. Dura, that's the interlamina view. So interlamina view, articular process view, and you move laterally, and that's your transverse process view. So basically that's what you look for. Okay, so that's your lumbar spine done. I'll show you the sacroiliac joint, and then that's the spine bit done. All right, the sacroiliac joint. The way to do the sacroiliac joint is what you do. You start to scan in the midline. Okay, this is what I call a seagull sign, or the medial sacral crest. You're looking at the sacral crest. Okay, sacral crest. Yeah, medial sacral crest. and that's basically your PSIS, posterior superior spine. Okay, then I come down, and when I start to see that, that's the S1 foramen. Okay, because you're looking at the foramen. Then I come down a bit, then I see S2 foramen, and then I move a bit more laterally. And you see the gap there? That's your sacroiliac joint. So this is the lateral sacral crest, ilium, sacroiliac joint. Very subtle movement. So let's recap that. Midline, yeah? Dorsal sacroiliac ligament, yeah? Posterior superior iliac spine. Come down. S1 foramen, yeah? S1 foramen. Come down. Just saw the S2 foramen. And you see just at the S2 foramen, lateral sacral crest, ilium, sacroiliac joint. So the way you would do this injection is you bring the needle like that in the lower part of the sacrum, in plane. You're gonna come there. Okay, that's your sacroiliac joint injection. So that's done.